So tell us the most rewarding story that you have delivering a baby, whether you're a labor and delivery nurse or whether you're a midwife. I know you must have tons of them. I'm not jealous, but I love talking to OB doctors and midwives, because I mean, you guys get to do some cool stuff. To bring a baby into the world is, you know, by and large, you're bringing in a healthy person into the world. It must be the coolest feeling. I can tell you, as a father, just seeing my kids born is the coolest thing. I can't imagine seeing it hundreds of times. So Tell us a great story. I know you have lots of them.
Goodness gracious. I'm one of those people where you put me on the spot and I'm like, I know nothing. There's nothing in there. So I would say, probably the breech one that I was talking about, like that one, that poor mama, I'd actually seen her, for all 3 of her pregnancies. I delivered her first baby, and then my partner delivered her second baby. I was out sick. I was supposed to be on call that day. I was so devastated that I missed it. But she did beautifully. And then this go around, we actually ran into each other at the fair. We had a booth at the fair this year. And so a lot of my previous patients didn't know like where I went or what had happened. And my previous clinic wasn't allowed to, you know, if the receptionist, you know, they just could say Stacy's no longer here. They weren't allowed to be like, oh, she's down the street, you can call her here. And so just seeing that patient at the fair was super exciting, and to see her littles. And then just to like continue to like make a plan, like, okay, this baby is breech, and okay, we're going to try this at 37 weeks. This baby is not staying down. You know, a lot of providers won't flip a baby more than once. Like it's really rare to do that. There definitely are some risks with versions. My backup provider doesn't like his patients to be like have numb. Like a lot of times we'll do epidurals or spinals. He doesn't like that because he can't tell how painful it is. And so if you're got an epidural, you're like, whatever, do your thing. And you know, that can increase risk of complications, where if you can feel everything he's doing, there's a big difference between the pressure of rotating a baby versus the pain of your placenta, you know, pulling away from the wall. So that piece is definitely important as to why, like, it was okay to try again. And the baby flipped really easily, had plenty of fluid. And so it was very rewarding to be like, okay, we finally got this kid flipped. And then I had to fight for her because the hospital has very strict policies on, like, you can't intervene before 39 weeks. Unstable lie is not a medical reason, which drives me absolutely bonkers. And so we put a belly band on this girl and like tied her up with this like binder to hopefully keep this baby in place. And then I brought her in at midnight on a Friday night. So she showed up like 15 minutes before to get her, start her induction, because we couldn't do it till she was officially 39 weeks. And then we started the process. And so just being there for that third baby and just watching her littles grow it's very special. It's very sweet. And just to be there, to be like, okay, we're going to get this, like, because she was terrified of a C-section. Like that was like her worst nightmare. And, you know, just to be able to continue like, okay, like, let's reassess, like, what can we do now? Like, what's going to be safe? What's going to be best? And just reaching that goal of that vaginal birth. And she did amazing. And yeah. So.
That is a great story. And it makes me wonder, I mean, so 3 of her babies were breech, right? Is that what you said?
2 of them were. Her first one was not. She has big babies and she has a lot of fluid. And so there's just, once there's all that uterus is stretched out, there's all that room. And so her second baby just like had all this, you know, room to swim around, and they like to be breech. But her second baby, they flipped once and stayed down. This child, the third one, you know, the third one's always the troublemaker.
And you got to wonder, I'm just thinking, just physiologically speaking, is there a reason that baby was not wanting to flip? What would the reasoning be? There
definitely could be. It's one of those things where you probably would need like an MRI to like really see what the uterus, like sometimes they have unique shapes to them. It flipped beautifully, but obviously had plenty of room to flip right back. So it's hard to know definitively.
The baby just did not want to be down, did he? I can just picture that in my head. It's like, no, I'm going back up.
Yeah, that's the way she wanted to be. So.